Okay, there we go. So, like I said, I'm going to talk a little bit about some economics, just in graphs, really. As you know, these slides will be available so people can look at them. So what's going on economically? I mean, there's still some bad news out there, and still some good news, of course. Santa Barbara is looking a lot like the U.S. In many respects in terms of the trends in the economics. I should say that the labor market itself is not back to the pre-pandemic levels, but there are other parts of our economy that are way above, like the stock market and housing, rents, et cetera. So we're going to see that time and time again. So this is a picture for this is for the U.S. This is for the U.S. and goes back to 2005, and you can basically see the blue bars throughout are going to be recessions, and we're still in a recession according to the National Bureau of Economic Research. You know, it's hard for them to untangle whether we're in a recession from COVID or we were in a recession to begin with. A lot of it has to do with COVID, of course. But so you can see what happened, for example, during the Great Recession, and during the Great Recession, we were. There we go. In the Great Recession, you can see that employment had been increasing. We hit, 2008 and came tumbling down. One thing I want you to realize here is, it took a while for it to tumble down, but it took us a lot longer to get back to where we were pre-Great Recession. The point there is, it took us about, from 2008 all the way to 2014 to get back to the employment level we saw then. So, in about 6 years, it took to get back to that level. And then, as you see, we kept growing, and the pandemic looks a lot different than that, obviously. We see how fast employment fell by, a substantial margin, way bigger than during the Great Recession. And it started to recover very quickly. And then we slowed down a little bit as these waves continued up and down. The employment still went up, but you can see we're still, 8 million people away from the pre-pandemic level. So there's still a lot of work to do. We've started to come back, but obviously there's more to be done. This is for Santa Barbara. And you can see, again, very similar looking trends in total employment. Again, it took a while for us to fall during the Great Recession. And again, it took a shorter period of time for us to get back to the pre-pandemic level than the US as a whole. So several types of economies can rebound very quickly. Again, you can see that during the Great Recession, it took a long time to fall, but during the pandemic, we fell very rapidly. And again, we're still pretty far below that pre-pandemic level. Okay, so again, total employment, not back. And then the industries that were hit particularly hard, leisure and hospitality, for example, in the US, again, what I'm showing you here is US data. Again, hardly fell at all during the Great Recession. As you can see, fell a tiny bit, then grew, massive decline in the pandemic. And again, we're not back to where we were pre-pandemic. Now, will we get back to it? Who knows? I mean, I think that many in this industry have chosen to operate a little bit differently. That could continue over time. This is Santa Barbara. So in Santa Barbara County, again, leisure and hospitality, and I've broken this one up into food and drinking establishments and accommodation. And you can see that the accommodation industry, hotels, et cetera, are not even close to getting back. So, that's a big issue, especially here in Santa Barbara within the leisure and hospitality sector. And again, you can see that in restaurants and stuff also looks, quite bad. So, by the way, people ask me, are masks effective? And I say, you know what? they're kind of effective at keeping people away from restaurants and hotels and airplanes. So, you know, I think on all fronts, masks are effective, and they'll get, and Vaughn and Lynn will get to the masks, the health part of it, but they're effective in keeping people away from stores. So it's better not to, you know, play around, and let's just get this over with fast. Wear your mask, get vaccinated, and let's get everybody back to work. That's my little editorial. But anyway, so so this is retail trade. Again, you can see retail trade faces, you know, very similar looking during the Great Recession, growth, and you can see retail trade, as many people know, started to kind of tail off a little bit far before the pandemic hit. You know, and many people are believing that, you know, because of online sales, whatever, you know, the retail trade sector is going to be falling. Who knows? You know, I think it'll get back. I don't think it's going to continue to fall like, say, manufacturing did. Then you can see during the pandemic, massive fall, and again, not back to the pre-pandemic level, though this one's a little bit closer. This is Santa Barbara, retail employment. Again, very, very similar, and not back, though doing much, much better, obviously, than hotels, employment in the hotel industry. So unemployed persons, you can see, again, we're not back to pre-pandemic levels. They're still, you know, somewhere like, you know, 2 to 3 million people, more people unemployed today than pre-pandemic. So we still have a lot of work to do there. And as we know, that there have been benefits that have been extended, increased for unemployment insurance, and those are pretty much becoming a thing of the past. Not quite done yet, but soon. This is for Santa Barbara County, and again, looks quite similar. We still have a lot more unemployed individuals today than we did pre-pandemic. So, you know, things are improving. You can see that sometimes they wiggle around a little bit as different things happen in our industries, especially with the different waves, and Lynn will talk a little bit about the waves. What's really striking, by the way, is that job openings, so these are the number of job vacancies that are out there in the US economy. And what you can see in blue, this one, that's for leisure and hospitality. So there are, you know, 1.5 million vacant jobs in the leisure and hospitality sector. In retail, you can see there's also a substantial number in retail, but these numbers are higher than any other time we've ever seen in the history of the data, which goes back to December of 2000. So this is just astonishing. And I just showed you that there are lots of unemployed individuals still out there. So it's something now about why aren't these individuals getting back to work, given it's easy to find jobs right now because there's so many vacancies. Well, a lot of people talk about because of increased unemployment insurance, et cetera, that it's very difficult. Another point of view is that individuals during the pandemic maybe reached out and tried to change occupations. Maybe they're increasing their skill in other ways. But this is another way to see this. This is the number of unemployed individuals and those job openings that I just showed you. And what you can see, and it's very interesting to an economist, of course, that what you can see is that today there are more job openings than unemployed people. Not so during and after the Great Recession, where there were a lot more unemployed people than job openings. So what does that mean? Well, you know, if there are 100 unemployed people and one job, they're all fighting for that one job. Today, however, you can see that there are more jobs available than people, unemployed persons, right? So it's a very, very good time to get a job, yet we still see unemployment much higher than pre-pandemic. One thing to take note of is that even though earnings, as you can see in blue here, these are average hourly earnings, have increased recently, the problem is that inflation year over year has increased by more. So what does that mean? It means over this last year, yes, earnings went up, average hourly earnings, but some of that was eaten away by inflation. So real earnings actually fell. So every time the red line is above the blue line, that means your real earnings, your real income, your real consumption is going to fall. And every time the blue line is above the red line, that means that earnings are, real earnings have gone up. So the Fed obviously is talking now about maybe thinking about raising interest rates. They're still mentioning that they think that this inflation is temporary due to supply chain issues, some of which is pandemic related, of course. I think anybody who's tried to buy a car recently or an Xbox, because of the chip shortage, there are no goods out there. It's very hard to buy cars, Xboxes, all kinds of electronics, etc. Okay, so real earnings have actually fell over the last year. Now, on the other side, you can see the stock market has just gone crazy during this pandemic. The NASDAQ just shot right up. You know, it's basically doubled since the beginning of the pandemic, and the same with the S&P 500. Again, showing rise after rise after rise. We're not talking about whether things are as a bubble or overvalued. That's a topic for another day. House prices, well, you know, again, crazy. So if you thought that house prices were high right before the Great Recession, look at them now. They've skyrocketed. San Francisco, Los Angeles, basically every place that you can look at, these large cities that Case-Shiller looks at, you know, have really skyrocketed and are many of them much higher than they were after the Great Recession even. This is for some MSAs in California. Same story. You can see Santa Barbara. These are the home value index. And so you can see many of them have surpassed where we were during the Great Recession even. This is the change in home prices. And if you were a little bit worried that house prices, you know, maybe are too high and that things are going too fast, well, you can see that in terms of house price growth in many places in the county, you know, they're exceeding 20% year-over-year growth rate. That's not a sustainable number, right? 20% growth in housing. That really is not really sustainable. So finally, we can turn over to talk about health a little bit. I had really hoped, and I hope Lynn and Vaughn don't take this the wrong way, I really hope that I never talk to them again. But here we are, right? So we have to talk to them again. Things have, you know, gotten bad again. And in case you haven't seen some of these things, this was from the CDC about the teacher in Marin County, unvaccinated, unmasked, reading to students. And basically this study shows that basically 12 out of the 24 students were infected during this class, and obviously affected some family members too. And then an 88-year-old professor in Georgia had students coming in, and he asked them to wear a mask, and someone said no. I guess the professor asked a few times and said, I retire. Right in the middle of class, he just retired and walked out. The controversy remains on both sides. So, you know, that's why it's important to have Vaughn and Lynn here to really talk about, you know, what's been going on, what they're seeing with the science and policy. So with that, I will turn it over to Vaughn, who has some slides, I believe, and then feel free to be asking questions, everybody.
Great, thank you, Peter. Fatima, if I could have my slides. So this afternoon, I'll be covering, giving you an update on our case rate. What does it look like between vaccinated and unvaccinated individuals? What's our vaccination looking like? What's our hospitalization rates looking like? And what's our county's capacity to test, to give vaccines, and to be prepared for the booster shots once they are approved by the FDA for the general population. Next. I'd like to start with this chart, which compares case rate by vaccination status. And any of these slides or charts that I'm about to show, you can find them on our website at publichealthsbc.org. So this graph describes our case rates by vaccination rates as of August 27th. When we look at our countywide case rate, that's the gray line in the middle, that is showing us to be at 19 cases per 100,000. But when we drill down to see who's getting infected, that the red line at the top shows that the rate is 32.3 per 100,000 among unvaccinated individuals. And the line on the bottom, the blue line, shows a low rate of 7 per 100,000 among vaccinated individuals. So we can see that cases were 4.61 times more likely to be unvaccinated than vaccinated. And you can see the trend lines between the gap between the red line and the blue line is fairly substantial. I'm encouraged when I look at this graph and see it over a period of time, I'm encouraged that we are now seeing the cases trending downwards for both vaccinated individuals as well as for unvaccinated individuals. Next.
Vaughn, I'm just going to reshare to make sure that the slides are in full presentation mode. Can you give me just one quick second?
Sure. There you go. Great. This is a recap of Santa Barbara County by the numbers for September 1st. So we can see that we have 176 cases being reported, and that is an increase from a 2-week average of 123. We did report 2 new deaths in our community. We have in totality 734 active cases. And again, this is an increase from a 2-week average of 667. We have currently 82 individuals hospitalized, and of that number, 21 are in the ICU. So when we look at the totality of the pandemic, we have 39,389 total cases. And we experience a loss of 480 lives from our community. Our case rate as of August 28th stands at 19.3, and our testing positivity as of August 28th is 6.1. So these continue to be fairly high numbers. Next. This is our hospital capacity. So the graph on the left-hand side describes the percent hospital beds in use. So roughly, we have remaining 31.5% of our hospital beds available to the public. And that is, for me, that's unacceptable. That means that hospitals have begun and have been initiating postponement of critical medical procedures. On the right describes our percent of staff ICU beds in use. So we have 26.3% of our ICU capacity remaining. And as of last night, the hospital system in the San Joaquin Valley, the region contiguous to us, they have reached below 10% ICU capacity. Lynn shared with me that on her end, she and Cottage have received the notification to be on standby to accept transfers from the San Joaquin Valley hospitals. So that's what we are seeing when we have we want to safeguard our hospital capacity for emergencies, for medical procedures. So when we see hospitals reaching its limit in other areas, it does invariably affect ours as well. This graph shows vaccination rate as of yesterday. We have 65.2% of eligible Santa Barbara County residents fully vaccinated. So roughly 1 in 3 eligible persons in our community is still yet to be vaccinated. And that means that 133,562 people need to get vaccinated so that we can exit out of this pandemic a lot sooner than later. Next. When we have cases raging in our community, we see outbreaks, and the numbers increase on a daily basis. We have 63 active outbreaks currently. And what's interesting is that I did a press interview right before this, and the numbers increased just in that short span of time. We have 10 outbreaks among businesses, 26 outbreaks among schools, and 27 outbreaks among congregate living facilities. And our team of 21 contact tracers, contact investigators, outbreak mitigation efforts among our team around the clock, just to protect our community, just to mitigate further spread. Next. So part of mitigating the spread of COVID-19 is having the testing capacity in our community. So public health continues to support schools, support the agricultural community, the shelters, as well as private employers, organizations, by linking them up to state partnerships for that free testing. We do continue to support community testing sites in Goleta, in Buellton, in Santa Maria, here in Santa Barbara, as well as Lompoc. And we additionally have petitioned for a minibus to come to Goleta, Santa Barbara area. And I believe we just received confirmation that within 2 to 3 weeks, we will have that minibus. Next. So along with testing, we are in partnership with community agencies to do outreach, to make sure that our community is hearing about vaccine opportunities, that they are hearing information and facts around vaccination. So in the first column, we have a group of partners under the WeVax grant from the state, working on either directly vaccinating individuals or doing outreach. So that includes Marion, that includes Lompoc Valley Medical Center, our Fighting Back Santa Maria Valley, our Herencia Indígena. And then in the orange column, it's another grant that we support, and that is through MyCOP, through the Lompoc Valley Community Healthcare Organization, through CAUSE, through Casa de la Raza, through the NAACP. So these partner agencies specifically reach communities that may have language access issues or cultural access issues. And then in the last bucket is the Vaccine Equity Project. And this is funded by local philanthropy and operated and coordinated via the United Way. And so we have Casa de la Raza, we have the NAACP, we have the Children Family Resource Services, which slash the Promotores Network. We also have the Children's Resource Referral of Santa Barbara County as well. Cottage Health is doing a lot of work training the community on about vaccine outreach around and training our promotores as well. We have Doctors Without Walls participating. We have FSA, we have FLA, we have Good Sam. We also have the Mental Health Association in Santa Barbara County. We are also joined by People Self-Help Housing, as well as Planned Parenthood of California, Isla Vista Youth Projects, as well as the Santa Barbara County Education Office, again, the Promotores Network. So these are all the partners that we have boots on the ground, day in and day out for the past 6, 9, 10 months, really reaching all groups in our community to make sure that they have access and the information to choose to accept the vaccine. Next. So some of the work that these partners do, they are either providing direct vaccinations, or they are hosting vaccination clinics. They are doing door-to-door canvassing. They are doing phone banking. They're dropping off flyers, mailers. They're doing videos and PSAs and radio spots in different languages. They are tabling and hosting booths at community events. They're providing incentives to the vaccination clinics. And they're hosting town halls and webinars on our behalf as well. So a lot of heavy lifting with regards to making sure that everybody in our community knows about vaccines, where to get it, and available to answer any questions that they may have around vaccines. Next. With regards to vaccine, where folks can get vaccines, this is a snapshot of all the different providers of vaccines in our county. So really access is not an issue anymore. We have a total of at least 35 providers in the North County, 11 in Mid County, and at least 39 providers or access points for vaccinations in the South County. And the number continues to grow via our public health mobile clinics. We ramp up, we deliver services on an as-need basis when our community reaches out and asks for vaccine clinics. Next. With regards to the pending approval by the FDA for boosters in across the country, so we're looking at sometime late September, giving booster shots to the general community. And so what we did is we began the planning several weeks ago, assessing all of our community partners, how many vaccines can you deliver on a per week capacity? And so all said, we are, as of today, we know that there is at least capacity to deliver 16,184 shots per week between all of our partners. And so this is a really good number, but we're not satisfied with this. We continue to network with our remaining healthcare providers to really strongly encourage them to build their capacity to deliver vaccines, especially among the pediatric population. Next. Just want to end with a thank you, a heartfelt thank you to all of our partners, as well as our community for all the hard work and for partnering with us in keeping our county safe. And that is my pandemic cat that gives me a lot of, his name is Frodo. He gives me a lot of joy and recharge because we are going into the 19th month of COVID response. Thank you.
Great. Thanks so much, Vaughn. So Vaughn has to possibly leave a little bit around 1 o'clock. So, and just in case you didn't get, there's a couple of questions here. So Vaughn, I'm just going to ask you a couple of questions so that, if you have to get off. So the first one is, can you speak to the county's use of a vaccine mandate as an employer? I read the county would be implementing a mandate, but the press release said details to follow. Has a mandate been implemented at the county level?
So our board passed a 4-to-1 policy that by the end of September, that our staff will either demonstrate that they are vaccinated or they can test on a weekly basis. So the details of that policy is still being ironed out. Here in our public health department, we join the rest of the healthcare community in implementing the state health officer order for health care workers. So our department has been in compliance since the 23rd in either vaccination or tests, and then we'll be fully in compliance by the end of September as well.
Okay, great. Another quick question. Do you have a breakdown of vaccination rates by city or North versus South County?
I do. If I can move around and quickly share my screen. I have no, so this is a little bit, let me.
I mean, you don't have to do it now. I mean, because the slides, we can probably incorporate it.
Yeah, so I do. So let me just walk through that slide. So we do, on our website, you can access our vaccination by the region, by north, mid, and south. And in addition to that, you can also drill down to the zip code level. So we do have several zip codes primarily in the North Cap portion of our county that we are working with in community partners in those zip codes to really bolster the vaccination rate. And I broke it down zip codes by eligible population side and the cities and the vaccination rates for the last 4 weeks. And the takeaway is I am happy to see that the vaccination in these zip codes, in all of them, are trending a little bit upwards since the approval of the FDA for Pfizer. So I will include that in the PowerPoint.
Okay, great. Thank you, Vaughn. Okay, now that was great. So now Lynn, the infectious disease specialist, will talk about some of the medical the science that's out there, that things we know about. So Lynn, take it away.
Thanks, Peter. Thanks, Vaughn. Always wonderful to hear your talk and see your slides. I'll have to get my jab back at Peter quickly. He opened by saying he wished he didn't have to talk to me. I will shoot the same thing right back at you, my friend. But in all seriousness, this is actually, I think, the third time perhaps I've been on with EFP, and every time I'm just so grateful. I think to hear, I think the economic perspective of what's really been going on. I think the one opening comment I'll just make that struck me as you spoke, because it applies to a couple of my first kind of topic slides, is this employment phenomena that you demonstrated within certain sectors is also, of course, remarkably hitting the healthcare industry. And there are questions arising that make, are very logical questions. Why is San Joaquin County, having to transfer patients when the levels aren't anywhere, the total numbers of patients in a hospital aren't anywhere near what they were, in January? That's certainly the case at Cottage, and yet we are working incredibly hard to staff our hospital today with, again, just the list of people behind the scenes that I think we have to remember are keeping our hospital going. Our nursing leadership offices, people who are perhaps no longer working in an operating room because the surgical services have been cut back and are now working on different floors around the hospital, and even just the HR maneuvering to make sure that we can again get up tomorrow and make sure that this hospital is ready to take care of people. It just takes a lot of work by a lot of people. All this to say, I am looking forward to talking to you guys about the state of the hospitals across our area, as well as delving into a little bit of the background data to support the mask use orders that are in place currently. And then finishing off with hot off the press, even in the last 12 or 14 hours, variant information. So without further ado, I will share my screen. Just look for a verification from Vaughn or Peter that you guys can see that. All right, fantastic. I think I'd be faster at this by now. Okay. So again, the state of our hospitals. Our hospitals are remarkably busy right now. I think some of you know my I would say day job is when I'm not doing COVID response work, is I'm faculty attending for the residents at Cottage. And I'll just say, from our own experience, these last 6 weeks have been some of the busiest weeks we've ever had as a program, just the number of patients in the hospital. Some of those are COVID patients, but a huge number of them are not COVID patients. And the explanations are complex and very heterogeneous, but there's certainly the explanation that people have been out of care for 1.5 years and are now coming to care. We have the convergence of the COVID pandemic with now a mental health and substance use crisis. Among very many other reasons that I think our hospitals are feeling the strains, again, not just from this recent surge due to Delta of COVID patients, but unfortunately, the underwelling underneath all that is just this remarkable volume of patients that need hospital care right now. So looking at the graphic that we've seen many times, this is Santa Barbara County, and thanks to the Public Health Department, the EPI team, amazing work they do, collaboration with the dashboard, the community dashboard team, and everyone at Legacy Works in the CEO's office, to provide us with this really updated every single day, here from really the beginning of the pandemic back in April of 2020 until just this week. We see the number of people in peach here, the lighter color, who are hospitalized in Santa Barbara County, compared to the number of people who are in ICU level care in Santa Barbara County. And again, this goes to the point I just made, that our numbers right now are straining our systems for several reasons, including the staffing challenges that we're having, even though we are far from the peak that we saw back during the winter surge. Nevertheless, unfortunately, we are still at Cottage, at Marion, at Lompoc Valley, taking care of very many patients across our county today. Looking then at Cottage specific data from Pacific Diagnostic Laboratories, which is essentially the Cottage lab, we see that similar pattern play out with regards to simply how many cases we were seeing in our labs, which again mirrors the community. And this is again the bump from last summer, the big surge in the winter, and then now what we're seeing as the Delta surge. And I point this out because we're seeing what I think Vaughn alluded to, which is, although we had 176 cases yesterday, the last 5 to 7 days before that did start to really show what looked more than just noise, in that we were starting to see at least a small downtrend. I'll pause here and just make the point, and I should have prefaced my whole talk with this. I've learned from experience with you economics people that you like data and charts, and so I'm going to bombard you with data and charts. And I apologize if it's too much, but I love this. I love the data, and I know you guys love it. So and I'll make sure that my slide set in its entirety is available to anyone through the website or elsewhere. But just to make the point that even though we're seeing this nice downturn, the concern is we are at that magic maybe 14 days or so, 10, 14 days since a lot of schools restarted. And so, what we're hoping is that 176, that case count from yesterday from the county, as Vaughn's EPI team reported, We're hoping that that's noise, but that was a big jump up. Again, just the second highest day that we've had in these last 4 or 5 weeks, in fact, for many months. And what we're hoping is that, today we don't see bigger numbers, and then, next week, bigger numbers, and on, as we start to see perhaps the results of just more of our community members, especially those under 12, bumping into one another again. Here we see a graphic that I've shared in one prior talk, and I wanted to give credit for this and the last graphic to our CFO at Cottage Health, Brett Tandy, who's just really from the beginning of this pandemic been following the data on this and sharing it with a group of us daily in a way that's been so very instructive. But it's a fascinating way of looking at the correlation during the winter surge in blue dots primarily, with our recent cases in red, the last 30 days in red. And what you just follow me, this isn't time, this is actually essentially number of cases. It's the number of positive results we had over 7 days through our PDL lab across our community, relative to or compared to the number of admissions to the hospital. And everyone knows this by now and has kind of seen this and heard this, but as cases in the community rise, so too do hospitalizations. And what's interesting is to look at the comparison of that winter correlation with that slope that was a bit steeper, that nice trend that it had, and yet it was a steeper trend than we're seeing right now. These last 30 days, that correlation's a bit lower. In other words, for a certain number of cases that Vaughn's team reports in the community, had we had that number of cases in the winter, we would have expected more hospitalizations, or indeed not just expected, but seen. And what we're seeing right now are fewer. And for those of you who've been following this closely for the last 2 or 3 weeks, I think it's starting to perhaps, not jive well with what we're hearing about Delta. We're hearing good data, great data out of the Lancet Journal and others that say that compared apples to apples, Delta compared to Alpha, we are supposed to be seeing more severe disease. If we take one unvaccinated person with the Delta variant versus one unvaccinated person with the Alpha variant, there are supposed to be perhaps twice as many hospitalizations in those who get Delta. And yet here in our community, within our Cottage data, thanks to Brett for following this so closely and his team, we're seeing almost an opposite phenomena. In fact, the slope is down by about 1/3. And so the question is why? And lots of thoughts about the why. Of course, there is perhaps this time around, we're seeing a younger, healthier population, less likely to be hospitalized. Perhaps as a community, due to the tremendous efforts by so many that Vaughn mentioned, we do have very good vaccine protection as a whole cohort. And so perhaps, again, we're really seeing that and feeling that. Perhaps this is just early in this surge and maybe the curve will start to move up. All this to say, I just wanted to reiterate for those who've heard me talk about this graph before, thanks again to Brett, we're continuing to see really this cluster, this trend continue. I couldn't finish hospitalizations without mentioning pediatric hospitalizations. So fortunately in our county, we have not been hit tremendously hard on the inpatient side with pediatric hospitalizations. However, throughout the pandemic, we have had pediatric hospitalizations, including recently. We've had pediatric hospitalizations from severe COVID, but we've also had pediatric hospitalizations due to this multi-system inflammatory condition, which thankfully is very, very rare, but of course, unfortunately, a life-threatening complication of COVID infection that usually shows up 2 to 6 weeks after the initial infection, even if the initial infection was relatively mild or even asymptomatic. And so all this to say, we've read a lot in the media about what's happening with pediatric hospitalizations across the country, and I just wanted to show the CDC data. Again, there's so much wonderful data available for anyone who wants to play with it. And all I did here was take the CDC's data from March of last year until 2 weeks ago, and simply selected for just those in the yellow color who were 0 to 4 years old in the hospitals, and those who in the gray who are 5 to 17 years old. And so what you're seeing here is, again, this kind of, even though the numbers are low relative to the number of adults that we're seeing, it's still very concerning and worrisome that what we are clearly seeing is that the number of pediatric hospitalizations in the United States are really starting to abut that level that we saw even during the worst of the winter surge. So certainly something to keep an eye on. Let's talk about vaccine efficacy and boosters. So I'm actually going to take the liberty of sharing a group of slides that were released by the CDC earlier this week during the CDC's ACIP meeting, the vaccine expert meeting, the scientific review. But I thought that it gave us a very nice overview of where things stand, but also perhaps provide some nice background to some of the, well, just where things lie with regards to boosters, I would say right now. So total number, everyone can see here, 365 million doses administered. Here we can see the breakdown, as Vaughn told us, amazing work in Santa Barbara County. We have about 65% of eligible people vaccinated. And here we see the breakdown across the whole United States. If we include everyone over the age of 12, over the age of 18, or over the age of 65. And here we also, for anyone who's curious, we can see the breakdown by which vaccine type. Pfizer, of course, has been the most commonly given, then Moderna, and then Johnson & Johnson, still a very huge number, 14 million people. When we look at the licensing, or not the licensing, excuse me, the authorizing studies for each of these three vaccines, these were the graphs that we all looked at very closely as the emergency use authorizations were given. And just to remind everyone, this is time from the first day of the dose of a vaccine. And these are, every one of these little bubbles is a person. And this is how much COVID occurred on the y-axis. And so what you would expect and what you see is placebo. There was no effect and the line just marches up. There was COVID going on. They got a dummy vaccine. They got no protection. But then what we see clearly for Pfizer very quickly within about day 10, similarly with Moderna, and of course, similarly with Johnson & Johnson, we see the divergence. We see the protection start to kick in. And just to remind everyone, these are staggering graphics. We're not used to this amount of success of vaccines. And so by all means, all three of these vaccines have been huge successes in their initial EUA applications. But then the question is, what happens 6 months later? What happens 8 months later? And that's what the CDC's ACIP, Dr. Sarah Oliver, and her colleagues, that's what they really tried to explain, I think, to the group who was going to have to make these decisions for the CDC and come forth with a recommendation. And so what they reviewed were a variety of good quality studies that looked at vaccine effectiveness against both hospitalizations, but I'll show you later, infection generally, from March, where the numbers were very high, all the way to July. And the good news, again, while certainly there's a slight trend downwards with regards to how effective these vaccines were in July compared to back in February, the good news is these vaccines continue to work so very well for the reasons that they were designed, to prevent hospitalization, life-threatening illness, and death. And if I don't say that 3 times, I should. That is what these vaccines should do, and it's what they continue to do, which is just, again, very good news. Here's the problem. And this is the problem that we've talked about a lot. When we look at all infections, so not just severe disease, but all infections, multiple studies are, of course, showing that around July, vaccine efficacy looked like it fell off. What was happening in July? Delta showed up. And that's really, I think, the million-dollar question. Is this drop in vaccine effectiveness, in other words, is this increase in vaccine breakthrough infections due to Delta, or is it due to time? Is it simply that these vaccines need some help with a boost? And that's, I think, really the million-dollar question at this point. Other ways to look at this are, again, infection here on the left, or hospitalization and severe disease on the right. We can divide it up, and this is, again, CDC data with all the references for people who are interested in pursuing any of these slides. This is the pre-Delta era in the blue, and then the Delta era in the orange. Again, a slight dip down with hospitalization and severe disease, but still maintaining very high efficacy. And unfortunately, dropping down quite low into even 39, as many of you have heard from one of the Israeli Ministry of Health reports. And so, again, continues to beg the question, should we be doing boosters to prevent infection? And then the CDC really finished up this conversation this week by pointing to some really interesting and important subgroup analyses, much of which hadn't yet been released actually publicly. And so I'll share again her slides. Here she breaks down how effective the vaccines are for symptomatic infection for Pfizer for adults over 60. And what you see is that for, so the dark blue are younger folks under 60, and the light blue are those who are more mature, who are above the age of 60. And so what you can see here is that for Alpha, again, the vaccine efficacy was very comparable and very high, but just zooming into Delta, we clearly see a drop off. And you know, this looks like it's not related to time. These people all got, vaccinated within, a month or two of one another, but we're clearly seeing this big dip here. And this is, I think, the foundation of the suggestion that maybe the wise booster approach up front will be focused on perhaps adults who are older. Similarly, if we look at those over the age of 65 and the vaccine efficacy against hospitalizations, we also see a similar trend, essentially, that, again, the vaccine efficacy does seem to wane over time more for those over the age of 65. And then I'll just finish up with this, because I think this is really perhaps the most telling. As much as I continue to feel very strongly, and I think most of my ID and public health colleagues would agree, that these vaccines are doing a really, really good job of protecting our community at large against severe disease, it's not perfect. We wish it was, but it's not absolutely perfect. And then the question is, well, who is it less perfect in? Who are getting severe disease, who are fully vaccinated? And that's what this chart shows us. Here we see again, April, May, June, July, and this is hospitalization. And what you see here are a variety of curves based on ages, with this very, very interesting fall off of those who are 75 years and above. Now, clearly, there's other factors that could be at play. They also were likely to be people who were vaccinated that 1 or 2 months early. Is that an important factor? Or is it something about the cell-mediated immunity of a 77-year-old compared to a 46-year-old? I think this is exactly what the ACIP hopes to answer in these next few weeks as they delve into more data. Let me then move on to what evidence we have for masks as a mitigation strategy. So a lot of calls for this information, and I certainly can't claim that this is going to be a comprehensive review of all evidence, but I wanted to hit what I think are maybe 3 or 4 important studies for people who are interested in reading more. The first came from Nature Medicine last year, and this, for context, in the world of infectious diseases, we actually really, until the pandemic, a lot of us were on the fence with regards to whether, wearing a simple surgical mask was actually very beneficial at preventing routine respiratory virus. We certainly wore our tight N95s to prevent measles, tuberculosis, disseminated varicella, but the true benefits of surgical masks, I think, have been far better studied and understood in this last 18, 20 months. So here they took a group of patients who had a variety of respiratory infections, and I give you just the graphic for those who had coronavirus. This is how much virus they had on the y-axis, and this was their, every dot is a person's result. So this is how much virus they had in their nasal swabs, it was high. This is how much virus they had in their throat swabs, also high, but a little lower. And then what they did is they randomized, and all these patients, again, in this graphic had coronavirus, natural coronavirus, a human coronavirus. And half of them were given masks and half of them were not given masks. And then they were to breathe. And if they wanted to cough, they just coughed. They just observed them, let them be, let them breathe, let them cough. Again, they were sick with coronavirus. And what they looked at is how many droplets could they detect from those patients who did not have a mask on compared to those who had a mask on. And the data is pretty striking. The mask stopped those droplets from being detected for the people that had a mask on. And similarly, if we're looking at even smaller than 5 micrometers, micrometers, again, similarly, there was more aerosol spread actually than droplet spread. But again, the masks were very protective. So this is, I think, one very important foundational study that, again, was published in Nature Medicine for anyone who wants to read more. Then population-wise, if you're more interested in kind of policy effects with regards to masking, this I think is a good place to start. And there are a variety of studies that have since referenced this that you can certainly go reading. This is a look at the 15 states that early in the spring implemented mask mandates. And it looked at what happened to those states compared to the states that didn't institute mask mandates in the 21 days or more after those mask mandates were put into place. And so again, what you can see here is this was really day 0. And this is where they set the 0. And what you see is that while before the mask mandate went into place, there was a fair amount of ongoing daily case rates. After the mask mandates went into place, then the case rates did start to drop in those communities. Again, lots more to talk about for anyone who's interested in that, but a good reference. This third one is just a study out of China where they did, again, very intensive contact tracing and investigation for what happened within homes. And I'll just cut to the chase, which is that when people in the home were wearing masks fairly regularly, including before anyone was sick, there was actually a 79% protection with an odds ratio of 21.21. Again, this idea that it's actually the pre-symptomatic time is a very infectious time for a lot of people for a couple of days. And so if you're going to be wearing a mask in a household, you really have to do it all the time, which is not to say I'm advocating wearing a mask in your household. But I think it goes to the point of when we don't know whether someone's going to be unwell in 2 days, and we're around people that, we're certainly never going to know that, perhaps the public, in a classroom, in a workplace. This is, again, one of the foundations to demonstrating that benefit. And then finally, Peter touched on it, Vaughn touched on it, but I think it's landmark, and I hope everyone would agree, just this very interesting case of the teacher's experience in Marin, and not just the number of people that became infected, but also the proximity, the layout of the classroom, and just, again, this idea that the closer you were, the higher your risk, the farther you were, the lower your risk. And then finally, I'm not going to talk about this, but this is a good reference, again, for anyone who wants I think a very thorough evidence-based review of a lot of the data behind face masks. All right, and then I'll finish off with, Peter, just a couple of comments on variants, if I may. I know that I can Fitz-plain for a long time. So is that okay, Peter? Can I just do a couple more slides? Okay.
Of course.
So, thanks. So this is CDC data from May until last week, and this is a breakdown of all the variants in the United States, essentially what fraction of all of the COVID cases were each of these variants. P1, the Brazilian variant, is in green here. Blue is our alpha, our B.1.1.7. And then, of course, we have here in orange the Delta variant causing that really overwhelming surge in India, entering really, I think, the United States as an important presence, other than sporadic cases in perhaps late May. And then by June, really accelerating and in a very remarkable way, just really taking over, absolutely dominating. And so that's what we're seeing now, of course, 98% of, I think that's the data it has here. 99%, excuse me, of the current isolates across the United States are indeed B.1.617.2, the Delta variant. In California, we're seeing the same thing. So this is, again, all publicly available, but just to show you here, this is the Delta breakdown by month in California from March until late August. Now 98.2% of all specimens collected in California are the Delta variant. Santa Barbara County, I was grateful to participate in the research project with UC Santa Barbara and Cottage Health collaboration, generous support from Direct Relief and a couple of other private supporters, able to really look carefully at what was our breakdown and say with confidence, we really didn't have any Delta back in February, March, April, as we were coming out of that big winter surge, but we certainly had a lot of our West Coast variants. And now, public health has done just a tremendous job of getting more and more surveillance results from the state labs and elsewhere. And again, Dr. Answerk has told us to the media in the last few weeks that the vast majority of results he's seeing are maybe 95, 98% in our county are also Delta, just as would be expected. So I'll just finish with this last slide that I think the other important variant news to consider, remember that evolution, this development, this ongoing kind of change never stops. And so, you know, there are now more than 25 sublineages of the Delta family that are being tracked, AY.1, AY.2, and just important to keep our ear to the ground. A couple of these were labeled, you know, the Delta Plus variants. The good news is that, you know, at this point, there's no good signal that one of those has really aggressively dominated and taken over with immune escape tendency. I'll mention the Lambda variant, C.37. We did actually have a small number of what we would have called Lambda variant back in the spring in Santa Barbara County. At the time, you know, this was out of Peru, and at the time it wasn't even a variant of interest by the WHO. It's still not a variant of concern. It's still not recognized by the CDC as a variant to track. But the good news is, I think, you know, Dr. Ansorg and his colleagues or his team are working really closely to continue to keep an eye on this. And to my knowledge, there have been no additional cases of C.37 locally for several months. Again, just speaking to how dominant Delta is. People have probably seen in the news in the last 48 hours that the Mu variant, B.1.621, was labeled formally by the WHO as a variant of interest earlier this week. This was identified in Colombia, has some potential immune escape mutations, just something to keep an eye on. And then finally, a lot of sensational news in the last, again, just 12 or 18 hours about C.1.2, which was identified in a pre-publication article in the last 2 days by some South African researchers. Concerned because there may be some features of its mutations that give it more infectivity or immune escape. There's still relatively very few number of cases. It has been found throughout South Africa and in many other countries, but still not clear how worried to be about this yet, and something I know that many of us will continue to track very closely. Peter, with that, I will thank you for your attention and hand it back to you.
Great, thanks so much, Lynn. That was great. I love the data. Fantastic. Thanks to Brett too,
Yeah.
who's actually on the EFP board. So.
Oh, I didn't even know that.
Yep, and he provides us with lots of interesting data at our board meetings. So just one quick comment. I was talking too fast when I was going through my slides. So in actuality, the NBER, who calls recessions and calls them when they're over, they said the recession started in February 2020 and ended in April 2020. But I showed you a lot of graphs where you would not have said, it looks like things ended because we're still way, way below where we should have been. So I called my own recession. And those blue bars were my recession because they look at various things. So if there was some confusion there, I didn't really mention that properly. But okay, so now let's get on to a couple of questions. So someone said that these new variants are more infectious, but maybe less virulent than alpha. Is that something you're seeing?
Good question. Definitely, unequivocally more infectious. I showed a little bit of this data, but I'll expand on it. Unfortunately, when we actually were to take, if we take 100 people with Delta who are unvaccinated with the Delta variant and 100 people who are unvaccinated with the Alpha variant and compare those two, unfortunately, those with Delta are actually more likely to need to be hospitalized with severe disease. That, though, doesn't take into account that in our community, 65% of people that are eligible are protected from severe disease. And that's kind of what I was pointing out with that data that shows the Cottage experience, that we should be seeing, for how many cases we're seeing in our community, we should be actually having far more hospitalizations if it was apples to apples from the winter, from the Alpha and from the West Coast variants. And the good news is that we're not. So that's, I think, the infectious disease piece is that, again, as a virus, Delta is probably more likely to cause severe disease. There have been about 5 important big national studies that have shown that across the world. However, we have vaccine protection, which is really helping. But I'd be interested in Vaughn's perspective from really the public health side.
Okay.
Thanks, Lynn. And I would say that I think that the takeaway is the level of protection through vaccination in our community. We're seeing the good results of that. However, I do want to point out, though, that we're seeing a little bit of a difference between hospitalization in the 3 hospitals, right? And so definitely because Cottage In South County, we have a higher vaccination rate than the mid county and the North County, and we are seeing a difference in the number and the severity of disease in North County and in mid county. And then when you look at the rest of the state, it really correlates the level of vaccination versus how virulent and how severe community members are experiencing. And I think that this is a good opportunity to also, what I'm hearing a lot, and I don't know, Lynn, if you're hearing this, is, oh, so what? So what? It's really the people who are elderly and the people who have tons of comorbidities that are ending up in the hospital, that are ending up in the ICU, and unfortunately are dying. We're not seeing that. We are seeing a younger population, and frequently we are seeing that there aren't any comorbidities. And so we're looking at hospital data, we're looking at admissions data, and analyzing it by demographics, and age, ethnicity, region. And then we're also looking at pre-existing comorbidities, and we're not seeing what people are telling us.
I see. Yeah, great. So another question. Do you have more immunity if you recovered from COVID than from the vaccines?
I can take this one. Great question. A lot of study on this, including even changing data this week. Story of my life. What we know is that people who have been previously infected and then get vaccinated, we know that they are far better protected than people, again, against infection and against severe disease, than people who are previously infected and unvaccinated. And so in my mind, I try to actually, that group has, what's done is done. They've been infected, they're previously infected, they are their own group, they are their own question. And so I stop comparing them to people who've not had infection. We have to separate these two groups. And then within that group of people who've previously been infected and recovered, the question is, are they going to benefit from vaccines? And the answer is yes. The answer is yes, from my perspective. Again, people are still studying this. And I think, I'm excited to always continue to follow not just the preprint publications, but more importantly, the peer-reviewed publications on this. But I think at this point, really from an ID perspective, we are emphatically saying that whether or not you've been previously infected, vaccination is absolutely critical.
Okay, great. Yeah. And here's one. I actually had this question myself. I just saw it. Can you explain the science about immune escape mutation?
Sure. Immune escape is a pithy way of saying the monoclonal antibodies might not work. The protection that you thought you had from a previous infection might not work. Or the vaccines might not work. So that's a mouthful. And so what we say is immune escape mutations. Something's changed in the genome of a new variant, for example, C.1.2, where there are some features of some of the other variants of concern that when the scientists look at that genome, they say, that spike protein, that furin cleavage site, something might have changed in such a way that those monoclonal antibodies might not work so well, natural protection from some other variant might not work, and maybe the vaccines don't work. And so all this to say that is what we define as an immune escape mutation.
I see. So another quick question that several people kind of asked in different ways. Which mask should we be wearing? Someone said that Europe is going to ban cloth masks. I haven't heard that, but someone mentioned that. N95, double masking, what should we be doing?
Vaughn, do you want to do the public health answer on this one? I'm happy to do the ID one, but
okay.
They're probably the same.
Yeah, I would say that, there is, I always approach this from layers of protection. The best is being vaccinated, and then you layer top on that masking. Ideally, the N95 is the golden standard, but we don't have not everyone has access to it. Not everyone has access to it being fit tested. And so it's not going to work in its truest intent if you're not fit tested for your N95s. That being said, is we recommend surgical masks. They're more accessible to the general public. But if you're in a situation where you don't have N95s, surgical mask, a cloth mask is going to be better than nothing. So I think those are the degrees that we would take into consideration.
I would just add, I agree, I couldn't have said it better. One of the studies I showed, the Nature Medicine study, interestingly, I mean, it was such a high quality study. They actually went to pains to not teach people how to put on the mask. So they actually just handed them surgical masks. If the mask fell off, they said that they did tell them to put it back on. But just to be clear, there was nothing special in that study about how they had fit tested those masks.
I see. Okay. Okay. Last question. I know we're running over, but Yvonne has to get off. But if you have had COVID Delta, can you get the booster? If you are immune compromised, do you have to wait 8 months from your last shot to get the booster shot?
So I can take this. I can take first stab at this one. So remember that the variant that someone's infected with is of public health importance and infectious disease importance, but it's not of clinical importance. And what I mean by that right now is that we actually don't test people for what variant they've had in a way that changes the recommendations that we as doctors are giving them, or that Vaughn's team at the public health department for isolation reasons are modifying their recommendations. So what I mean by that is, if you get COVID right now, you have Delta in our community. That's the fact. And so I'll say more globally, if you've previously had COVID, the question is, should you get a booster? And I think what we heard really clearly from the ACIP, from the CDC this Monday is not yet. That, and I was grateful for this. I think that there was, again, I try to stay, as apolitical as possible on all of these things, but it sounded like there was, conversation perhaps outside of the CDC about booster shots that had come before our scientists who are tasked with this review and these recommendations before they'd had time to review and to see the data. And so I think I was grateful to hear our scientists basically say, we're working on studying this. We're working on seeing more data from the manufacturer and other groups, but we're not yet ready to issue a recommendation for boosters. And so right now, I think the only group that's been approved, Vaughn's the one who has this great list, but are the immunocompromised group. And there's no specific additional groups other than very strict group of immunocompromised. Vaughn, I'd welcome you to jump in.
You said it perfectly. And I think the question was, if you are immunocompromised, do you have to wait 8 months from your last shot to get the booster shot? And I would say that you can get it right now it is approved by the FDA, and you can get it from your healthcare provider or from the pharmacies with just a self-attestation.
And there's no, thanks, Vaughn. There's no, the studies that looked at this, they didn't, it was just another 3 or 4 weeks, another 3 or 4 weeks. They actually studied it in give a dose, give a dose, give a dose, as opposed to give a dose, wait 4 months, wait 6 months. And so it's just a recommendation. Again, if you're a solid organ transplant patient on heavy immunosuppressant, some other qualifying condition, that you really probably should get 3 doses of mRNA vaccine and not just 2.
Okay, great. So again, thank you guys so much. This has been so informative. All I can say is, let's work hard to get this over with so we can actually go and have dinner together and have some fun. What does that mean? It means get vaccinated, don't get other people sick. If you're not feeling well, stay home, et cetera, et cetera. So lots of information is supplied through that Vaughn gave you earlier about where to get vaccinated, where to get tested. So, let's help each other out. And again, thank you guys so much. Really appreciate it.
Thank you.
Thank you.
Bye, everybody. Thank you.